Around 30 million Americans, 1/10 of the country's population, live with diabetes. Medical guidelines for treatment include healthy diet, exercise, and regulating blood sugar levels. As with many diseases, there are also unproven treatments that have produced anecdotal success stories. iNewsource reporter Cheryl Clark has this report.
Dillon is a small rural town of about 4,000 people in southwestern Montana's Beaverhead Valley. Here, everyone knows everyone, including Ron and Julie Briggs. 4 years ago, Ron, the county coroner, was ready to give up on his longtime fight with diabetes.
I've been a diabetic for 55 years. I have heard from everybody under the sun that everybody's got a cure for diabetes.
His diabetes was so severe, he often landed in the local hospital in a diabetic coma. But Ron's wife, Julie, would not give up hope.
And I thought, we've worked really hard, and I don't want my husband to die now.
Julie immediately started searching online for diabetes treatments and found a national network of clinics called Trina Health.
When you have extra insulin and you
G. Ford Gilbert, a Sacramento lawyer, founded the company in 2006. He claims he modified a procedure that was developed by a doctor he had worked with at the University of California, Davis.
You get your brain functionality back. You get eye functionality back. You get kidney functionality back. You resolve unhealing wounds that have been unhealing and weeping for years.
The 4-hour procedure involves infusing insulin into a patient's bloodstream through an IV. Gilbert says the infusions, as shown in this Trina video, help patients better metabolize carbohydrates, and that restores their health.
Any person who truly understands what we do is wildly impressed and enamored with the outcomes we achieve.
Many in the medical community are not convinced. Dr. John Buse, a former president of the American Diabetes Association, is blunt in his criticism of Trina.
The pitch was pretty slick and compelling, whereas the evidence that I could find was pretty much non-existent.
2 years ago, at the request of a potential Trina investor, the North Carolina doctor spent hours reviewing articles Gilbert provided.
I would sort of characterize it more on the scam end of the spectrum of business opportunities.
Medicare and at least one insurance company found insufficient evidence that insulin infusions actually benefit patients, so they won't pay for them. But Gilbert had a workaround. Instead of billing the Trina treatment as one all-inclusive claim, his company submitted claims for each of the services separately. Ron Briggs began receiving Trina treatments in 2014.
I found something that would help with my situation. And it wasn't I thought would help, I knew would help.
Ron was traveling every week to a clinic in Scottsdale, Arizona to get the infusions.
After the 4th time, Ron called me up on the phone and he said, I don't know what we're going to do, but I have to do this the rest of my life.
Ron and Julie rallied support in Dillon to open their own clinic. They said they paid Ford Gilbert about $300,000 for fees and equipment. The couple begged Dillon's local hospital and its doctors to oversee it, including Dr. Sandra McIntyre.
And part of that conversation was, would one of you in this organization be the medical director if the Briggs chose to move forward? And we pretty much said the same thing, which is why would we be medical directors over a service that we don't think has scientific merit?
The doctors recommended the hospital not get involved. McIntyre says when patients have a chronic disease, they look for anything that will make them feel better.
And when someone offers something that really is painless, essentially, and cost-free to you, with this promise of a miracle, it hooks patients. It hooks them.
Without the support of hospital doctors, Ron and Julie opened their clinic in 2015. They hired nurses to perform the insulin infusions and treated as many as 15 patients. 2 of those patients said Trina was miraculous and even extended their lives. But not all saw their health improve. Some, like Ruby Monty, suffered severe side effects from the treatment process.
It was more than severe diarrhea, and I just couldn't handle it. I was getting dehydrated, and I'd come home and my husband would tell me that I just looked washed out.
Investors and clinicians have opened more than 24 Trina clinics in 17 states. In early 2017, Blue Cross Blue Shield of Montana was questioning the Dillon Clinic's reimbursement claims. Now, the private insurer and federal authorities are investigating Gilbert's billing practices.
There's no fraud. There's nobody a bad actor here.
But Ron and Julie's clinic wasn't the first to have billing issues. Blue Cross Blue Shield was already denying claims from clinics in Alabama. Reimbursement for the Dillon Clinic ended in April 2017. Ron and Julie say that's why their clinic closed.
I've invested $750,000 in this whole thing. We were told the insurance companies were in line.
You see on TV, you see all of these things about this medication. If you take this medication, your legs are going to fall off and your arms are going to fall off and your nose is going to turn blue and it's going to kill you. And the insurance companies are covering all of that. But something that helps and has saved my husband's life, they don't even want to look at.
But Ron's life wasn't saved. On December 22nd, 8 months after their clinic closed, he told his wife he didn't think he'd last the night. He wound up in a hospital with kidney failure, heart disease, and a blood clot. Days later, Ron died. When we spoke with Gilbert in February, he had no doubt he would continue to expand his network of clinics.
We will achieve remedial treatment for hundreds of millions of people. And I say that without a worry in this world.
Ford Gilbert was arrested last month on federal public corruption charges in Alabama. He is accused of fraud and bribery in a failed scheme prosecutors say was intended to get a state law passed to force coverage of Trina infusions.
And very adamantly and respectfully pleaded not guilty.
A state legislator and lobbyist were also arrested. All three have denied the charges. The clinic in Dillon remains closed. Its future is unclear, and so is the future of Trina Health.
Go to iNewsource.org to read the entire series on Trina Health. For iNewsource in San Diego, I'm Brad Racino.